All right, I think we're going to go ahead and get started. And actually, to begin, I'm going to have Raquel open up with a land acknowledgement for us.
Hello, Madowe. So welcome to our session. Before we start our panel, we want to acknowledge the land we are on today. We are gathered on the Hohokam, Fort McDowell, Yavapai Nation, Gila River Indian Community, Salt River Pima Maricopa Indian Community, and Tohono O'odham Nation. And if I mispronounced any of those, please forgive me, and because I'm not very good at that part. So let's take a moment to remember and respect the original stewards of this land. Their traditions and wisdom teach us the importance of community and resilience, crucial values in efforts to prevent substance use and suicide and promote healthy lifestyles. It's important for all of you attending this conference to educate yourselves about Indigenous peoples and their cultures. By doing so, you can become allies in our shared mission to combat substance use. Understanding and respecting diverse cultures is a powerful form of prevention. Thank you.
Thank you, Raquel. And thank you all for joining us today. We are very excited about this. My name is Brittany Matero, and I am a partner and SVP at Encena. We're a woman-owned consultancy. We work with digital health technology companies and health information exchanges and federal and state partners, really to grow and expand and be successful in the work that they are doing. And of course, because we really want healthier outcomes and a healthy America. So appreciate you joining us. And to my left,
good afternoon, everyone. Thank you for having me. My name is Ashley Taylor. I am the Director of Behavioral Health at the Iowa Tribe of Oklahoma. I'm a licensed professional counselor, a licensed alcohol and drug counselor, and I have been working with the tribe for about 8 years. So I'm very glad to be here and help answer any questions that you have about the programs that we have been able to implement in our very small community.
Ha Madoweka Nananiatsa Raquel Ramos Natsay Namana. Hello, my name is Raquel Ramos, and I am a member of the Comanche Nation of Oklahoma. I am Comanche on my mother's side and Cuban on my father's side. I am the prevention manager for the National Indian Education Association. I've been in prevention since 2013, working in tribal communities. And so I'm just really thankful to be here and be able to share the things that we've been able to do in Southwest Oklahoma and across the nation. Thank you.
I don't know if I can follow that up. No. Hello, my name is Don Ramos, and yes, Raquel is my wife. So, and we get to share this opportunity with y'all. Y'all probably noticed I'm on the deal twice. So I was currently working with Wichita and affiliated tribes, but since my invitation here, I have switched roles and moved back to my own tribe, the Comanche Nation, that I originally started my career at back in 2005. And gone back. I was with the Wichita affiliated tribes for 7 years, working in the suicide prevention and suicide field. So I moved back to the Comanche Nation and became the executive director about 3 or 4 months ago in the residential treatment and outpatient services. So I was the program development director at the Wichita and affiliated tribes when I left, and now I'm the executive director. I am 1/4 Comanche, 1/4 Kiowa on my mother's side, and I am half Puerto Rican. So with my father's side. I've been in recovery for 26 years. Been working in the field of substance use, thank you, and substance use, prevention, and suicide altogether for a living for over 20 years. So, and I'm grateful for this opportunity and sharing what knowledge I have gained in working in this field. I'm an Native American addiction specialist. I'm not licensed, but I think I have enough recovery experience to share some knowledge in working in the field, and gained a whole lot more knowledge in the last 7 years in the suicide field, which I am also a applied suicide intervention skills facilitator and do mainly a lot of that training in Native communities. Thank you.
All right. So just a couple of housekeeping items. So there are QR codes for you to scan and engage. I will say, though, that it told me that there was a QR code for Slido, and I don't see it up there, so we might not do those questions. And also, it says scan to submit your questions, and it's showing me Slido and not questions. So please submit them, and if for some reason that doesn't work, please remember what your question was, and we'll have you come up and ask it. We really want this to be interactive. We want you to engage, to be curious. We know that you are here because you are interested in working with tribes, or you are working with tribes, and so we want to be able to answer questions that you have, and hopefully further the discussion so that we can have more collaboration across all of the good work that we are doing. So, all right, with that, I will ask my first panel question. And we will start with you, with how are the programs in which you work incorporating traditional cultural practices into your prevention, treatment, and recovery service programs?
So in 2018, we received our first SAMHSA grant with the Tribal Opioid Response Grant. And that grant allowed us to get our medical providers DEA waivered at the time to provide MAT services. And so during the course of those 2 years, we really focused on being able to bring those services to the opioid prevention and be able to start to tell the community about the things that we offered. The traditional practices has been something that we are really strong in bringing and continuing to bring through our programs. So we now have worked over 10 federal grants since I've started there in 2016, and each of them we've been able to use. We're very committed to using the White Bison programs, so 12-step medicine wheel. We are in our jail systems teaching Warrior Down, which is an offender reentry program. And we've worked really hard to get all of our staff trained in mending broken hearts. So we're very, we want everybody to be able to come back and utilize those programs. If you're not familiar with those, please ask us, because I think all of us have used them in some way, and they are amazing. And then we also have worked with our veterans and bringing in the sweat lodge. That's something that we're still trying to get implemented more on a regular basis. So we just keep continuing to bring in our elders. We want them to work with our youth on teaching them those traditions and keeping them going.
Thank you, Ashley. Raquel?
Thank you. So I work in the prevention field, and in 2013, we received our first prevention grant through SAMHSA. And at that time, it was a strategic prevention framework, tribal incentive grant. And back in 2013, there wasn't a lot of Native-specific data. Who runs off of data? Kind of, sort of. Yeah, everybody's like, yeah. And that's just the way it is. And so we didn't know what we didn't know back then. And at that time, we didn't realize that culture is prevention, or how to use culture as a prevention tool. And so through our focus groups in 4 surrounding counties of where our main tribe was, we asked simple questions to our youth. We asked them things like, are you proud to be Native? Well, sure. What else is there to be? We asked them, do you think that there's a problem in your community, without telling us who, what, when, where, the individual is. And so they told us. But what was really strange is that all of these young women, especially young girls that were there, I knew them. I knew them in the powwow arena. I knew that they all had danced next to each other. Whenever they would honor somebody in the gourd dance, all of these young girls would stand there and they would dance with them. And they would even honor them themselves. But they didn't know each other. I would ask, do you know so-and-so? Oh, yeah, that's this club's princess, or that's that club's princess. And so I thought to myself, I said, Self, how do we get these young people talking? They've known each other since they were knee-high to a grasshopper, but there was no communication. And so one of the things that, she's laughing at my knee-high to a grasshopper. Okay, I'm from Oklahoma, y'all. And so one of the things I had done was I started doing culture classes, because a lot of our young people, they did not know how to introduce themselves Hamadoekan and Aniatsa in their tribal language. And so we went from there to being able to make your own regalia. And so learning their language, how to speak their language, and just those simple tasks just moved our reduction of substance use and suicide and alcohol significantly just within 1 year. And so through that, we were able to, we could teach them how to make a hand drum. We could teach them the language. We could teach them how to make their regalia that they get out into the arena in. But if we don't teach them or give them a space to put it into practice, all we've done was taught them a skill. So one of the beautiful things about prevention and what we were able to do is we started a powwow group. And so now our kids were hosting and co-hosting powwows. They were speaking their language. They were presenting, and that's going to be in some more questions. So that's one of the things is culture as prevention, culture as a prevention tool, and giving our young people spaces to be able to utilize them, using the language, using different other tools to help them succeed.
Donnie?
How do I follow all that up?
Let him go next.
You're up.
Like I said, how do I follow that all up? No. So to add on to that, so we're talking about prevention with adolescents and young people. So we realized that in doing that, we also could take it into the treatment side. And using culture and prevention, all we have to do is just take it to the adults or those with substance use disorders, and use the same modality in getting them back involved into their traditional culture, hand drum making, getting them back and tying them back into that. Sweat lodges, like Ashley was talking about, the Native American church. Somebody says, what is the Native American church? That's our it's our practice of our beliefs. And I'm in the recovery field. My feeling was total abstinence. Now, how do we use peyote? Because we all think, oh, that's hallucinogenic. So I had to educate myself on that. So I go to the elders, which I'm an elder now. They call me a baby elder. I just turned 62. Just turned 62. Now the older elders are now calling me the baby elder, so I guess I'll never grow up. No. So I had to educate myself on the Native American church and to find out what this medicine is. It's medicine, and it's their way that they practice. So I learned about it. My recovery comes from the 12-step fellowship, which was back 26 years ago when I started this journey, was total abstinence. Drug is a drug is a drug. And we practice total abstinence. But now we're in the day of harm reduction and stuff, so I had to be educated about that also. But we also go back, and I'm going to jump around, and we go back to this prevention and this continuum of prevention. Some of y'all is aware of what the SPIF model is and that continuum cycle. So I found out that for me, and what I utilize when I talk about substance use disorder or suicide or any of our behaviors, is learning that the continuum of care is always a continuous circle. So no matter what, it's always a repeat. So we use our culture and we use our traditional values consistently. With our treatment side, we get them back involved into learning our culture. Drum making, regalia making, gourd dancing, powwow, Native American church, the sweats, anything that connects them back to having that purpose back in life again. So that's what we do, utilize and how we practice using our culture.
You all have such amazing stories. It's just been such a pleasure to spend the last couple of days with you. And I hope that each of you will take time to get to know a little bit more about each one of these presenters and their stories. But can you talk about a particular success in a program or a service that you're really proud of and some of the key elements that led to that success? And Donnie, we'll start with you.
Gosh, over 26. I think one of the key successes that we've had, I think recently would have to be the 988 Tribal Lifeline Summit that we had in Oklahoma last year, and Ashley was a part of this. Oklahoma has 39 tribes in Oklahoma, and I talk about 988 because Oklahoma has 13 tribal 988 grantees, which is a lot. So we have a work group of all the grantees in Oklahoma, and with state partners, the call center, Solari, and URCs, the BHCs. Always get confused on that acronym there. And they're part of our Tribal 988 work group. And we were able to put together a summit, 988 summit, when I was working with the Wichita and affiliated tribes. And on short turnaround, and 988 leadership came down, Marion Redmond and Monica Johnson and her team came down for the first day, for the summit, and participated and got to see some of the work that we're doing in Oklahoma with the Tribal 988 work groups, and in what we're trying to do, and that is to make a uniform care across the state of Oklahoma when it comes to 988 and suicide crisis care is what we're working on. And we're trying to advocate for policy change. Our main goal is to get the inception of option 4, like the state of Washington. We will have another summit here in a few weeks, November the 19th and 20th. But I think that was one of the great achievements of recent, was to have SAMHSA leadership come in and participate. They knew we were doing this, so we had our Region 6, and then our tribal liaison, and then all of SAMHSA leadership come in and participate in that. So I thought that was a great deal. And we're getting SAMHSA buy-in, and I think that's real great for tribes, not just in Oklahoma, but tribes everywhere, to get a seat at the table. And I encourage tribes to reach out and get a seat at the table, in places like this here. Because, the old saying, if you're not at the table, you're on the menu. If you're not at the seat. So that's one of my our accomplishments, I would say. We don't do this by ourselves. We have to have a group and a team.
Thanks, Donnie. Raquel?
Okay. So whenever we think of lived experience and we think of programs that help, so I celebrated 23 years in recovery yesterday. Yeah. Woo! And I'm only 25. I don't get it. It keeps catching up. Before long, I'll be passing myself. But so for my personal program that helped me was the Medicine Wheel White Bison 12-step, as well as sweat lodges. And I think that having that sense of belonging, because identity is really crucial when it comes to our Indigenous population. Where do we fit in? Where do we feel accepted? And where can we be ourselves, right? And, this takes us back to, which we'll talk about later, but takes us back to historical trauma and so on. Where's that sense of belonging? And I felt that sense of belonging with the Medicine Wheel White Bison. Now, mind you, I was born in New York City. Y'all just need to hear my story one day. I was born in New York City, grew up in New Jersey for a little while, and then came to Oklahoma. I'm half Comanche and I'm half Cuban. So there was always that split of, I talk too fast, because I do talk fast. Well, I can't help that I talk fast. Now I talk fast with an Oklahoma accent. But just finding something that fits who you are, because we as Native people have that innateness of coming back to our reality of being Indian, being Native, being Indigenous, but we're no longer other on that data box. So that's a good thing too, right? I just really, if you've not looked into the Medicine Wheel White Bison 12-step, Don Coyas, all of his teachings that he has. Not only does it help in the prison system, it also helps outside of the prison system. So it's really key. So that was my experience.
Thank you. Ashley.
So I want to very much agree with Dawn. Over the last year and a half or 2 years, the relationships that I feel like we have built through the 988 Tribal Response Grant has been amazing. We've gotten to do some really great things together, and it really feels like these tribal communities are coming together for the betterment of their citizens. But this question is my favorite, and I want to take a second to give you guys a little bit of background. So again, in 2018, we received the Tribal Opioid Response Grant, and our medical providers became DEA waivered to provide Suboxone to individuals who had opioid addiction. And we had a young man who came into the program. He was the very first patient that I saw there. So I saw him on the day that he saw the medical provider and was inducted with Suboxone. So he spent 3 hours in the clinic. He saw the medical provider. He started his medication. I came over and talked to him. For the next 2 years, for a year, he stayed on Suboxone, and he came in every week. Every week he came in. He saw me every week as a therapist. And 2 years into his sobriety, I said, "When are you ready to come and work for us?" Most of you are probably familiar or know what the peer recovery support specialists are, and as a therapist, I'm not supposed to talk to you about my lived experience. I'm not supposed to talk to you about what I've done for coping strategies, but as a peer, that is exactly what you do. And so 4 years later, Jordan came to work for us. He has now been with us for 2 years. He works with youth in our wellness center, and he does Muay Thai. He teaches them Muay Thai. He goes into the jail. He teaches Warrior Down. He facilitates our Wellbriety group once a week. And he is what I think is our success. He has been able to start from start to finish and stay in his recovery. He's very well aware that I'm telling his story, and I've gotten that with his permission. And it's something that I think as a program, 2018, starting with one person and a secretary, me, and we're 15 deep, and he's one of them, and he has been amazing. So yes, 988 has been amazing. Jordan is our success.
Well, Raquel, I'm going to start with you on this next one since you opened the door for this. When we think about the impacts of historical trauma, how do you address this as part of recovery? And I know that you do prevention, so if you want to address it as prevention, that's fine too.
So, whenever we think of historical trauma, we don't just think of, oh, well, that was a long time ago. We have to think of what came from that. We had the loss of our language. We had the loss of our land. We had relocation. We had no hugs at night. We had no I love yous. We had no holds. We had, and so whenever we think of that in today's terms, a lot of times our young people are still facing historical trauma, and sometimes they don't even realize it. Because we have in our tribal communities a lot of grandparents raising grandchildren, right? And so whenever we have our grandchildren or grandparents raising grandchildren, more than likely that grandchild or that grandmother or grandfather is a product of boarding school or is a product of historical trauma directly. And so whenever they're teaching their children or their grandchildren or the youth, then, what do they get? Do they get the solid loves? And I could speak from personal experience because I'm a product of boarding school. My mother was in boarding school. 2 lives. I have my Cuban life and I have my Indigenous life, my native life. My Cuban life, oh Lord, all the love and hugs and, just everything, just all of that social and that emotional and that everything, that you can imagine whenever we think of the medicine wheel. I received all of that. But on my Indigenous side, my native side, I cannot remember one time in my entire life that my grandparents ever spoke to me, that they ever told me they loved me, that they ever hugged me, or that they even ever touched me. Never in my life. So how does that reflect on my grandchildren? Donnie and I, we have 19 grandchildren, I know!
Because she's only 25.
And I'm only 25. Yeah. But we have 19 grandchildren, 2 great-grandchildren, and we have 1 great-grandchild on the way. So Christmas Eve is very plentiful in our home, and we love it. But how about if I didn't learn about historical trauma? And that's why I challenge everybody in here that works with, wants to work with, or even thinks about working with tribes. Discover what that is, because how about if the reflection of my mother, not understanding or not knowing that she may be passing on something down to me, which was true. My mother didn't raise me the first 10 years of my life. My dad did. I got all the loves and hugs. But then my mother finally started saying, I love you, once we moved back with her, and we showed her what that was. So our grandchildren today, so do all of the 300, 500, 600 youth that I've worked with over the last 10, 11 years, my grandkids hear I love you when they walk in my door. They hear I love you when they leave my house. They give me proper hugs. Even the teenage boys that think they're too cool for school, no. You come and give your grandma a proper hug, But that's just it, though. We have to understand that our kids today still suffer from historical trauma because their grandparents and sometimes even their parents are still products of that. Bridging that gap between our elders and our youth are so easy if we give them that space to do so. And I'll talk about that a little bit later on how we were able to do that in our area.
Donnie, do you want to add anything?
Yes, I'd like to add some. I don't know if I can follow that up, but I'll try and follow that up. When this terminology came around about historical trauma, I have a mentor, Mr. Walkeeny. Me and him would sit there and say, well, that doesn't affect us. That was way before our time. And more I got into thinking about this, and it came around, I sat there and I started thinking about it. I was wrong. I realized my mother was a product of that. My mother's mother died when my mother was 5 years old. So my mother grew up in a boarding school. So she was a product of that. No hugs. So guess what? My mother didn't give me the hugs when I was growing up either. My biological father I didn't meet until about 13 years ago. So I grew up with a stepfather. In Native communities, we don't call them stepfathers either. The father that raised you is your father. So my dad that raised me passed away when he was 52 years old. He grew up without a father. So when he was a teenager, so he grew up without a father. So he didn't have the hugs either. So we grew up without the hugs. So whenever I had children, I wasn't the touchy-feely father that gave the hugs because I didn't know how to be a father either. Nor did my first wife know how to be a mother because her mother grew up without that also. So then we go through this historical trauma, generational trauma, so on and so on, repeating itself over and over again. So it dawned on me, wow, yes, it does affect us. So we have to learn how to heal from that. So I didn't learn how to hug until I entered into recovery in the rooms of the 12-step programs of Narcotics Anonymous, because the NA people, they're huggers. For those that don't know that, the NA program, they're huggers, and that's where I learned how to hug. And I was very uncomfortable, especially if it was for a male to hug me. I was like, whoa, wait a second. I'm comfortable with that today. So I've learned how to hug, and I've learned how to show emotions and feelings, and so I understand that today. But yes, so working with Native communities and understanding that historical trauma is evident, and generational trauma. And I think that's not just with Natives, it's with all ethnic backgrounds and Indigenous people. So
I add just a small piece to that. So I am non-Native, born and raised in Illinois. So when I moved to Oklahoma, I spent most of my first part of my career in community mental health, in and out of schools, seeing clients, students, whatever. And so when I was asked to work contract at the Iowa Tribe of Oklahoma, I thought, well, I don't really know much about the culture. And for the first 2 years, I worked there contract, and all I did was see Native clients. And I learned so much during those first 2 years from my clients. So then moving into working with, the grant work and getting to go do conferences is where I really learned a lot about historical trauma. And as Dawn just said, I grew up in a very tiny farming community, and my dad never hugged, and I never knew why. And he would say, I can't remember my mom ever saying that she loved me, but I'm very much a hugger. And so learning about historical trauma has, most of you know about the ACEs questionnaire, and we implement in our programs every day. So when I went and participated in the White Bison Mending Broken Hearts training, I said, I'm a 0 on the ACEs. I don't have any trauma. Let me tell you. I am a 0 on the ACEs. That program will tell me that we all have some trauma. So again, I'm going to keep promoting the White Bison and the Mending Broken Hearts and the training, and we very much look forward to implementing those programs at the Iowa Tribe.
So one of our polling questions had been about what type of organizations you all represent. So I'm going to guess, do we have providers in here? Any providers? How about technology companies? Do we have any state, federal employees? Any other type of organizations? All right, I love the diversity. I love that you're all here. I mean, look at how many different types of people we have in the room. It's so fantastic. So as we think about who is in the room, who is really interested in working with you, where do you think some of the greatest opportunities lie in supporting tribal communities with behavioral health services? Who would like to go first?
Right here. Coming to these conferences, outreaching, meeting people, talking about what we do. I'm not going to speak for Dawn and Raquel, but we have learned along the way what works in our community, which may or may not work in yours. But I would love to hear what works in yours so that we can talk about if it works in mine, and vice versa. We're a very, very small community. Perkins, Oklahoma, south of Oklahoma State University, so that's a big community there. The Iowa Tribe of Oklahoma has about 900 citizens, and so it's small. And we have seen great success. Reducing stigma is something that we battled from day one. Individuals didn't want to come in the building because somebody might see them or they might run into somebody else, and we've really been able to work through that a lot by having our staff at programs. We have a couple staff members who go to an elders lunch and teach them workout, once a week, and they see them there and they love to see them, and so that's what brings them and reduces that worry about being there and really promoting our positive mental health.
Excuse me. So I think that if you're wanting to or trying to work in a tribal community, go in there with an open mind. Go in there not expecting. Go in there just as a talking circle. Because if you don't know who you're actually going to be treating, then, they're not going to be receptive to you. I think that being able to have a Native practitioner on staff is always key, but that's not always the case whenever you're going into a tribal community that Indigenous practitioner is not a part of. And I'll just tell you a quick little story. So I was working for the Comanche Nation, and we have our annual powwow, and we have our homecoming and things like that. And I went 90 miles north of my home, still in Oklahoma, to work for another tribe. And I already knew that I was going to implement this prevention program that has worked with the Comanches, that has reduced substance use, and all of these great things. And then whenever I got there, I thought, summertime, I'm starting in May, and summertime's going to be right here, and I'm going to have A, B, C, D, all of these things lined out. And I got there June 1st. I'm like, okay, let's go. We're going to do X, Y, and Z. And they said, no, you're not. No, you're not. And And I'm like, okay, why did you hire me? Is what I'm thinking, but I'm like, okay. They said, no, because that's our ceremony. We want our kids in our ceremony. They do Sundance. Sundance is different than Comanches because Comanches, we don't do Sundance. And so that story is to let you know that when you're going into a tribal community, know the community you're going into. Get with an elder. Talk to them first. Have a talking circle with the community, and then that way they can tell you and they can trust you, and then go in with what it is that you're trying to bring into that community. Because if not, you'll be on the outside looking in, and there's not going to be that balance that they need. We as Native people have to have balance, social, emotional, physical, and mental balance, and that's even with people coming into our areas.
Ditto. No. And that is true. In working with Native communities, specifically, in all the years that I've been in this field, that in working with Natives, we have to develop that comfortableness and that trust with them before they even open up. So, if you're a provider or wanting to be in the Native circle there, you have to have that. You're going to have several meetings with them first, like she said, that talking circle with them, for them to even get comfortable enough to even start opening up and having that dialogue. Me being Native, I'm not going to even get them to start opening up with me on the first visit. They're not going to trust me even knowing them, because they're guarded, very guarded. And so they're going to be standoffish until they get to know you and develop that relationship. So, and one way we do that is having those talking circles, having those meetings. Having those meetings with SAMHSA right now is that, hey, one of the ways we fellowship is providing a meal. Funding don't let us provide that meal, so majority of the time that comes out of our pockets. They need to open up purse strings a little bit, but but anyway, so that's how we invite people to the table and having those conversations with them, and it takes a while. And I found that more so with our Native clients, especially with and it's not just with our male clients; it's with any of them. In developing those relationships. And just like Raquel was talking about, from moving from one part of I worked for the Comanches for a while, then I moved to work for the Wichita and affiliated tribes, which was 45 minutes down the north, and it's a different Native community, and they had to accept me there first before they got comfortable with me. And I was up there for a little over 7 years. Now I'm back in my own community with my own tribe, and I'm having to be accepted by my own tribe again. So which has been good. I'm getting some good buy-in from them and some good positive support. So Wichita's want me back too, but I'm not.
And I also want to add on just a couple of other things. A lot of times whenever you're talking to our elders or you're talking to our kids, a lot of times there's not a lot of eye contact. I'm an eye contact person. I think that's my Cuban side, and that doesn't mean that they're not paying attention. Just see them as brilliant, especially our youth and our young adults. And then also, we're creative. The majority of the Native population are very creative. And so in my trainings that I do, I like to do a giving table, a craft table, and I just bring things like beads and, left brain, right brain. If you're working with your hands, more than likely you're paying attention and listening a little bit more. And, just find little things like that to be able to connect, because it's all about connection. But not only connection, consistency and commitment. If you say you're going to be back on Tuesday, where should you be on Tuesday? Back, right? Okay, so those are just a couple of things I wanted to add that I didn't hear.
Yeah, thanks. You guys, we only have 5 minutes left. And I feel like, I still have questions, but I'm not going to do them. And I wanted to give you the opportunity, but you probably will not all have the opportunity. So one question from the audience, and then you're just going to have to go back and talk to them. Yes, I saw your hand first.
One question. Hi, my name is Susanna. Thank you so much for sharing. I had the amazing privilege of how the Comanche tribe does different things from another tribe, and so they were like, a lot of like our funding, for example, for grants and stuff, people don't understand the diversity of American Indian tribes, and so we kind of just have to do like a pan-Indian approach, right? And then get funding as much as we can, which is still not much, and then try to apply it in a pan way, which doesn't really meet everyone's needs. And so I guess I'm just wondering, like, in your experience, like, has there been success in trying to address like those differences in the diversity of your communities? Because I think that's still a struggle from what I've seen.
I'd like to add whenever I help, nobody ever writes a grant by themselves, so whenever I help write the grants for the tribes that I've worked for, I never write it as tribally specific. I always include it as native community, because then it doesn't limit my reach for those non-tribal members or that non-native person that may be in that community, so it doesn't limit my services to them. So it helps me serve all within that area, if that helps. So.
Yeah. And then also doing, so you do have to use the universal Indian items, beading earrings and so on, and even making hand drums. So I know that as a Comanche woman, I'm not supposed to touch a hand drum. But as a preventionist, I am. So I have to pick my battles wisely, and so whenever I go in and I'm teaching the hand drum, and I'm teaching about the rawhide, and I'm teaching about what side's what, and I'm teaching about the circle of the ring and all this stuff, sometimes I have the men there saying, "Are you supposed to be doing this?" And I'm like, "Well, you know what? After today, you and your son are going to know how to do it, so I won't have to do it anymore. Because if I don't do it, who's going to do it?" Right? And so just being able to open up that kind of conversation. Now that let me bring you in as a facilitator. Or you want to be specific to your tribe, so what do you have to offer? And I'll bring you in as a facilitator. So, so that way we can kind of reach everybody without, but you have to use the PAN approach. But make it things that are universal to tribes as a whole in your area.
And I think that there are wonderful opportunities to expand that, right? So Donnie was talking about having a meal, and today they can't get meals paid for, but maybe in the future that will happen, right? CMS just approved several states to be able to bill for traditional health workers. And
SAMHSA did open it up to $10 per client on the tribal opioid response grants this last time.
On the tour,
Which,
it has now, yeah.
Which was a whole lot different than the $3 cap that was on there before.
So more to do, and we should all be advocates for it.
We
Yes.
need allies. Definitely need allies.
We are at time. I would like to just say thank you so much for coming, for the pleasure of hearing your stories and your experience. Thank you for sharing this time with us and just everything that you've spoken about today. And thank you all for being here.